Welcome to Self-Improvement Academy. Grow yourself every day with KOKOSHUNGSAN. Please subscribe and hit the notification bell for the latest updates. If you like it, please like, share it, and leave comments. Thanks for your support and for helping us make the world a better place. Anger management out of control. Anger is stemmed from hate, and when it is not dealt with, the person often acts out aggressive, putting self and others at risk. Persons acting out in anger often have underlying issues that is missed, or else has not been diagnosed. It could be relatively to alcohol and/or drug abuse, as well as mental illnesses. Often the individuals have difficulty dealing with their emotions and feelings and will attack out of anger. The root of this frustration is often rooted somewhere in the person's past. The individual may have been abused as a child, underdeveloped, or severely neglected. Another underlying cause may contribute to negative influences. For example, if a child has been bullied and no one handles the situation, he or she will probably develop anger and it will continue to grow. There are classes developed for people that have inability to control their behaviors or anger. The classes are designed to get the patient to open up and address his or her feelings and emotions, and then come to an area of management. The classes often have other individuals with the same level of uncontrolled anger, and together they work to get along with others. Often a trained therapist will conduct the classes, and deal with each other in a group-oriented atmosphere, allowing each person to explain his or her problems and situation. The therapist will often work to address each individual, sometimes making them angry in an effort to find the root of the problem. When therapist is dealing with hate and anger, they must stay alert since potential risks are involved. If a person is triggered and anger is the issue, the person may become violent. Violence is something we all want to avoid. Therefore, to deal with the patient, therapist must enter with caution. Again, there are underlying issues to address. Therefore, we must look at all aspects of the person's behaviors, thinking patterns, logic, and so forth. If the person is illustrating illogical thinking, then it is obvious we must get the person on track. Of course, the patient may have cause for the anger, yet we must teach him or her how to deal with it in a more suitable method. We can look at the thinking patterns, to determine if mental illness is the underlying source of the person's disability. If mental illness is involved, we want to send the person to a qualified mental health expert for evaluation. However, if alcohol and/or drugs are involved, we want to send the person to drug and alcohol classes. By combining mental health expertise, anger management classes and/or drug and alcohol classes, we can work toward recovery on the level of problem. After a series of treatment, it might be that the patient will also need medications to control his or her anger. Often when a person has anger issues and is allowed to talk through their problems, they often find relief and can move forward into a positive light. Anger is a miserable home to habitat, therefore someone is suffering as a result and everyone is at risk. None of us really wants to undergo pain and suffering. When a person has anger issues, it often affects the central nervous system, the mind, body, and so forth. This adds additional risks to the person suffering, and if not addressed, us are looking at more cash and time to deal with additional problems. If you notice, your child is showing aggressive behaviors, it is important to get help immediately. Most parents care for their children and often notice when a child is behaving inappropriately, and often it may be that the child has a mental illness from hereditary, is in need of immediate help before other symptoms develop. If you have a teenage child that is showing aggressive behaviors, you might want to sit him and her down and ask what is going on at school. If your child had not illustrated these types of behaviors before, then something is going on. Before it gets out of hand, help him or her to learn to manage their anger. Life is too short to let your child go unnoticed. KOKOSHUNGSAN pays you to have fun. Kakashungsan.net